Thank you. That was an excellent talk. And now I'd have the pleasure to introduce Dr. Anna Maria Vranceanu. She's a clinical health psychologist and researcher in the behavioral medicine service at Mass General Hospital, and she's associate professor in psychology at the Harvard Medical School. And her main research interest and program is on transitioning medical practice from a biomedical framework to more of a biopsychosocial model. And in doing that, she's been developing and implementing mind-body interventions for patients with NF. So we welcome you and thank you for speaking. She's going to talk about emotional health and NF.
Thank you so much for having me here. I always enjoy coming to the NF forums. I feel I always learn a lot from researchers as well as from the larger NF community. So I have to see how this works. So today we're going to talk about emotional functioning in NF, and I feel like this is a topic that applies to adults, children, adolescents, parents, NF1 and F2 neurofibromatosis. And I think it's a topic that we need to talk more about and we need to do more about. And I'm hoping to be able to convince you about that by the end of this talk. So in terms of our time together, we are going to define emotions and emotional functioning. We are going to talk about sources of emotional distress in NF. Why do we care about emotional functioning in NF? What are some current models of care in NF, and how can we better assess and address emotional functioning within the medical care? What are some of the challenges associated with addressing emotional health in NF? What are the current efforts? So what are some of the things that we're doing to address emotional function in NF? And I'm going to end with some hands-on skills practice, and hopefully we'll have time for questions. So I thought it would be important to define emotions and emotional functioning. So emotions are cognitive processes that originate in the brain. So the brain interprets situations, and then this interpretation leads to emotions and behaviors. And emotional functioning really refers to the load of positive or negative emotions. So if we have a lot of positive emotions, we're happier. If we have more negative emotions, we experience depression and anxiety. And it's really important when we talk about emotional functioning to think of it as a biopsychosocial mechanism. So it's impacted by our biology, our genes, our coping resources, the amount of stress we have, the amount of medical symptoms we have, and also our coping resources. So how well are we able to cope with these challenges? And so when we're talking about NF, and when we're talking about emotional functioning, it's important to think about what is the symptom burden in NF and what is the stress level in NF, because as I said earlier, this will impact the emotional functioning. And so about 5 years ago, we started doing a lot of psychosocial research in NF at MGH, and we did focus groups with adults with NF1 and F2 neurofibromatosis. We did focus groups with adolescents. We did focus groups with adults with NF2 who are deaf, and we did focus groups with parents. And so we ask them, what are your stressors? What are some of the medical symptoms that are bothersome? What are some things that you're doing to cope with these symptoms? And we recorded these focus groups and we analyzed them and we came up with some themes. And these themes cut across from NF1 and F2 neurofibromatosis and from adolescents to adults and parents. And so these are some of the themes, some of the things that we learned from patients. So there's a lot of stress associated with multiple medical treatments and multiple surgeries, pain, uncertainty about an NF progression, so not knowing what's going to happen with the tumors, if they're going to get bigger, if they're going to stay the same, if they're going to cause more symptoms, social isolation, guilt and worries, particularly for parents about, am I doing a good job? Did I pass the NF to my child? Unhealthy coping. So we actually learned that parents or adults or adolescents don't have time for physical activity, for healthy eating. Sometimes they drink too much. There's stigma associated with NF. There are challenges navigating school, work, peer relationships, a lot of appearance concern, particularly in NF1 and NF2, hearing loss is in NF2, and anxiety and depression. So very heavy symptom burden across NF1, NF2, and schwannomatosis. And because of this, no wonder that the rates of emotional distress in NF are very, very high. So research shows that for adults, rates of anxiety, depression, and stress are higher than the general population, while the self-esteem is lower. And when we look at adults, the rates of anxiety in NF are about 40%, almost double than what we see in the general population. Similarly, for depression, the rates are very high, up to 55% versus 15% in the general population. And these are clinically significant symptoms of depression. And we see the same in adolescents, with about 50% rates of anxiety versus 20 to 30% in the general population, and depression up to 45% in NF versus 13% in the general population. So obviously really, really high rates. But what was really surprising for me, and I learned for the past year, is that suicidality and suicidal ideation are actually very, very high in NF. So we are conducting right now a clinical trial of 2 stress management in adults with NF from across US and internationally. And so as part of this trial, we talked to 80 adults so far, and we screened them for participation. And part of this, we talked to them about their stress, about their mental health history, and we learned that out of this 80, 14 had been in an inpatient psychiatric hospital for suicidal ideations in the past 3 months. So this is extremely high. Now, when we enrolled 55 participants in the study, and everybody had to complete a depression questionnaire online, and out of this 55, 12 endorsed suicidality on a depression questionnaire, and the question was, do you have thoughts you were better off dead? And the answer that were chosen by these 12 were sometimes and often. And I called all these participants. 2 of them got really mad at me, didn't want to participate. But the other 10 really talked about how challenging it is to have NF, and they all wanted to participate. They all thought it was important. We offered them a higher level of care, but they said, we have these thoughts, and we're living with them, and they decided to participate. So I think it's really important to talk about emotional distress, because these things are happening, they're out there, and we need to deal with them. So again, just to summarize, why do we care about emotional functioning in NF? High rates of suicidal ideation, depression, and anxiety, decreased quality of life. If you're going to have these symptoms, it's going to be really hard to maintain your quality of life. In children, I think we've heard today quite a bit about challenges with the educational system. Some of these are because of cognitive functioning, but some of these are also because of depression and anxiety. If you have anxiety as a child, you're not going to be able to pay attention in school. Same with adults, challenges at work. We're learning more and more right now across medical conditions that the high level of stress and emotional distress are associated with wear and tear on the body, and increased risk for things like cancer, cardiovascular disease, and stroke. So it's really important to address this emotional functioning so that we can preserve both mental and physical health. And we're doing things for this. And before I want to tell you a little bit about the things that we're doing to address emotional functioning, I want to talk about this biopsychosocial model of health. And this is really based on the idea that biological factors interact with psychological factors, so emotions and coping, as well as with social factors, so social support and social network, to determine the quality of life and health. And most of the time when we're thinking about NF, we're dealing with the biology. But what I'm hoping to convince you today is that there's a lot of room to improve our quality of life and health by addressing the psychological and social factors. A seminal study that was published in the New England Journal of Medicine in 2007 showed that across adults in the general population, 10% of the factors that account for premature death are medical care, 30% genetics, and 60% behavior and environment. And obviously for NF, the medical care is much bigger than 10%, but this clearly shows that taking care of the emotional functioning is very important for our overall health. Okay, so what do we do? What do we do about emotional functioning, and what are some challenges? So addressing and assessing emotional functioning in NF is hard. One of the barriers to addressing is lack of awareness, and I think we've heard of this earlier. Doctors don't know. Doctors don't know about NF, and then even the NF doctors, not the doctors who are here, but most of them, they don't know about these high rates of emotional distress. There's a tendency to focus on the biology and the medical treatment, and I think we all want a cure for NF. We all want the tumors to go away, but I think it's really important not to forget about the emotional functioning. There's stigma associated with mental health concerns. So a lot of the times patients are not going to disclose. They're going to want to focus on the medical care. And doctors don't know how to ask. They don't have those communication skills that are going to help patients disclose their emotional distress. We also have a lack of trained providers, particularly psychologists and social workers, to address these things. I think it's very hard for a psychologist who's never met anybody with NF or read about NF to actually help a patient with NF. And so it's going to be really important to have more social workers and psychologists and counselors learn about NF. We also don't have tailored psychosocial programs for NF. I mean, we're definitely starting the work, but if you think about, taking cognitive behavioral therapy for depression, if you just take that program and give it to patients with NF, most likely it's not going to work because it's not really addressing the NF-specific stressors, the things that are causing depression in NF. And so we really need to talk to the patients and really learn about the concerns and develop these treatments that address NF-specific issues. And there's always challenge accessing care, right? So there are a few NF centers across US. And what we're trying to do at Mass General is we're trying to develop live video programs and really take advantage of technology to remove these barriers. Okay, so we're doing some things about emotional functioning. So at the Massachusetts General Hospital, we developed, with feedback from patients, 2 stress and symptom management groups. And so initially we thought that we could take people in a room, ask them to come to Mass General, and we could teach them the skills, and everything's going to be great. But we found low feasibility. So it was really hard to convince people to come to the clinic. I think we've heard this. The folks have a lot of medical appointments, jobs, kid activities. It's just really hard. We also had a lot of people who've stuck with the program once they started, but a lot dropped out. And good news, we found improvement in emotional functioning, pain, coping, and quality of life for those who stuck with the program, but many dropped out. And we had to restrict the treatment to Mass General. So after we sort of looked at everything, we managed to get some funding from Children's Tumor Foundation, and we switched the modality of treatment delivery to Skype. And now we actually moved to a secure telehealth platform called Video that's available at Mass General. And so we had high feasibility. Almost everybody who wanted participated. Almost nobody dropped out. And we found even more improvement in emotional functioning, pain, coping, and quality of life. And for the past year, we actually opened the treatment to adults from across US and even internationally, which has been really amazing because a lot of the times, particularly patients with schwannomatosis, they tell us that they've never met anybody with schwannomatosis before. And so we're really excited about this treatment modality, and seems to be very well liked by patients. So what are the things that we're teaching in these 2 programs? So a lot of the skills are similar in the programs. Things like social support networks, learning to set goals, we call SMART goals, in a way that's not intimidating and that's setting you up for success. We teach relaxation response skills, things like mindfulness, meditation, and deep breathing, balanced thinking, positivity, so how to develop positivity skills, communication with medical providers, and how to make lifestyle changes, but then also sustain them. And so the other program teaches a lot of the similar skills, but it's more focused on physical activity, healthy eating, sleep. And so the goal of both programs is increase resiliency and quality of life. So we're doing the study right now. I have some flyers outside if folks are interested. I think some of the faces that I've seen here today have already been in the study. And so I put together, hopefully this is gonna work out, I put together a video with patients' perspective. Yeah, so we actually asked about 6 adults who participated in the study to record a very brief video with their experience in the study, and then my 12-year-old son put them all together. So the quality is a little low. He did better than I would have done, and hopefully we'll get a chance to actually look at it. Okay. Sorry if it's a little loud.
Hello, I'm Greg Hagan, and I've just finished a study conducted by Harvard Medical School. I have NF1, and if you have an opportunity, you'll learn some awesome techniques that could assist you through the, going through the journey of NF.
I decided to participate in the study because at the time the opportunity arose, I was dealing with some anxiety issues on my own, and I had never really been around people who had NF, didn't know anybody else with it. I have run across numerous doctors who don't know anything about it, and I thought it would be nice to learn to deal with some of my stressors and to make contact with people who have NF, people who are like me, have dealt with some of the same issues I have. It was a wonderful experience. I truly encourage anybody who has the ability to participate. Definitely found out that I was not alone. Our sessions, we would laugh together and we would cry together, and I definitely felt better about myself at the end. Take care.
I thought it was really important to participate in the study to let others know that something was being done to address the adult with NF life experience. It was a wonderful thing to find out that there were actual things that could be done to help.
First of all, it was very beneficial. Just the group alone really was motivating and also inspiring. Just hearing their different stories and their background, and how every person with NF or NF2 have a different story and a different journey, and everyone is fighting to push through it was very inspiring.
I joined the study to learn about the effect of the stress on NF. What I found mostly helpful in the group setting was the fact that I could see how other people are dealing with their stress and what are the best ways to deal with it, and feeling that I'm not the only one who has all of those issues.
Not only did this study help become personal, because it was all patients diagnosed with the many flavors of neurofibromatosis, but that gave us a special connection. And even though we weren't physically in the same room, same location, it just gave it a personal feeling to go through that.
Yeah, I'm very grateful to the patients who put this together. Okay, let's see if we can get back to the talk. Have a few more slides. Okay, yeah, so we're going to switch to a few skills. And one of the first things I want to talk about is this idea of the mind-body connection, which it's a little counterintuitive for many patients, but it's really, really important. So the mind influences the body, and then the body influences the mind. So there's a lot of research showing that stress and negative emotions lower our immunity, so we get sick more often, and also increase risk for cardiovascular disease, stroke, and cancer. And I think that we could all experience the mind-body connection if we think of what we feel during emotional stress, right? So I know that I get headaches when I'm stressed. Some people get stomach aches or digestive issues, and that's really the mind-body connection. So why does this happen? This happens because we have a system in our body called the stress response. And anytime we perceive a situation as dangerous, we get thrown into this stress response. And it's really good that we have this stress response because it mobilizes our body to get ready to fight, flee, or freeze. And so during the stress response, there are changes in the body, things like heart rate increases, the blood pressure increases, the blood goes from the head to the big muscles to really prepare ourselves to deal with situations that we perceive dangerous. And when the stressor gets removed, the body goes back to baseline. The problem is when we have a lot of stress, when we have a lot of chronic stress that never goes away. And this is very common when you have to deal with a lot of medical symptoms, like in NF. So when you have chronic stress, the body never recovers, so you're always in this stress response. And that causes wear and tear on your body, right? If you think about, an engine just going on override and never taking a break. The good news is that we have a relaxation response, which is really the opposite of this stress response. The bad news is that we have to do something to move in the relaxation response. So it doesn't happen automatically unless we go on a vacation, right? But how often can you do that? And so as part of the stress management program, we teach people how to understand when they're in the stress response, understand what happens in their bodies and in their minds when they're stressed, and what they can do to move from the stress response to the relaxation response. And one of the simplest things that you can do, and in fact I think some of you are doing it because I've talked to you earlier today, is this idea of diaphragmatic breathing. So our breathing is something that we have with us at all times, and we could use it to feel better. When we're stressed, our breathing tends to become shallow and rapid, and we tend to have chest breathing. And a lot of the times, this type of breathing gives our brains a message of danger, and then the breathing becomes even more rapid, and this is how sometimes people have panic attacks. And so one of the things that we could do is to acknowledge, to pay attention to this breathing, and try to slow it down, and make sure that we engage in deeper, slower breathing. And how do we do this? Very simply, you inhale, and then you allow the air to go in the belly, let the belly extend, and then as you exhale, make sure the belly goes in and the air comes out. And if you do this 5 to 10 times, you will immediately experience a sense of relief because your body will go from the stress response to the relaxation response. And in fact, if you do this, you'll notice that your muscles are relaxing because you can't be breathing deeply and be tense at the same time. So it's a simple skill. You could do it at all times. Something else that we teach is we teach a variety of mindfulness meditation techniques. Some are for pain, some are for appearance concerns, some are for anxiety. But this is a core skill called the single-pointed focus meditation, and some people call it single-pointed concentration. So this works really well in times when there's a sense of overwhelm, right? So the mind is kind of going in all directions, and you just cannot focus on what you want to focus. And so if you focus on one thing, whether it's your breath or a word or an image, and anytime the mind wanders to your worries or stressors, you acknowledge that, but then you bring it back to your anchor. Over time, the more you do this, the more you get control over your mind, and you're able to tell yourself in situations when you're overwhelmed, yes, I have these worries and I have these concerns. There's nothing that I can do about those right now. I'm just going to go back and focus on what I'm doing right now. So it's something that works really well. It's going to take a lot of practice. If you're interested, I'd suggest maybe starting with 1 minute a day, something really, really small to get comfortable with it. And there are a lot of actually apps available. One that I really love is Headspace. It's free for 30 days. I have no affiliation with them, but it's one of the things that I use myself, and it's really, really good. Okay, so we also teach a set of skills that are called appraisal and coping. So these are based on the idea that our cognitions or thoughts, our behaviors, our emotions, and physical sensations are interrelated. And so if we were to take an example, and actually this is an example from one of my NF2 patients. So let's talk about tinnitus, right? When patients experience tinnitus, there's a tendency to have an automatic thought, such as, this is not fair, this will get worse, I can't stand it, I want this to go away. And this thought leads to a behavior. And a lot of the times this behavior is, I don't want to deal with this, I'm too sick, I'm just not going to go out, I just want to go to bed. And the emotion that comes, that's associated with this, is anxiety and anger and sadness. And the tinnitus actually gets bigger, because if you pay attention to something for too long, it's going to get bigger. But what if, when we experience those negative thoughts, we replace them and we say, oh, okay, here is the tinnitus again. My doctor knows about it. I know about it. I'm going to still go out. And I'm going to still interact with people. And anytime my mind goes to the tinnitus, I'm going to bring it back to the conversation that I'm having. Over time, what happens is that you experience improved mood, and the tinnitus becomes background, because the mind can focus on only one thing at a time. So if you don't really pay attention to the tinnitus, it's not going to be on the front of your mind, it's going to be on the back of your mind. And you could do this with any other medical symptoms. It works really well with pain, for example, where you learn to make the pain background so that it doesn't interfere with your activities. Again, it looks simple in this figure, but it's actually hard, and it takes a lot of practice, but it works really well. We also teach a set of skills that are called positivity. So one of the things we talk about is acceptance, right? So what do we do with the things that we can change? NF is one of them, or having to have a surgery, or maybe having an outcome of a surgery that you don't like. There's an initial emotional reaction, and that's important. It's important to sit with those emotions. But after a while, it's important to move on. And you move on first by accepting. And I know that a lot of the folks with NF are engaged in the community, and so this allows developing a sense of meaning, that you're giving back to your community, you're engaged with other folks with NF, you're maybe teaching. So any strategies that are going to help you find meaning and accept situations are going to help you move from the stress response to the relaxation response. We also teach things like optimism and humor. And I always say that there are some people who are born 100% optimistic, that nothing gets to them, but the rest of us, we really have to work at it, because it's very easy to interpret situations negatively or to get down on yourself. And so we teach folks how to become more optimistic, how to use humor, how to find humor in hard situations, how to laugh, because all of this are helping you move from the stress response to the relaxation response. We also teach empathy, and I think Karen was talking about this with children, so empathy toward yourself and toward others. I work a lot with adults with NF, and they tend to be tough on themselves, and they sometimes are tough on others as well. And so learning to understand other people's perspective, and also learning to understand, to take your side and develop compassion toward yourself can be really helpful. And finally, we teach appreciations or gratitude. Anytime we have a lot of stress, the mind has tunnel vision, and we only see the things that are not going well, even though there are always some things that we can appreciate or some things that are going well. And so part of the program, we asked folks to take a few minutes at the end of the day and think of 3 things that are going well, or 3 things that they appreciate. And in this way, you're forcing your mind to see the bigger picture of your life instead of being stuck on something that's negative. Okay, and the last skill I'm going to talk about is this idea of setting goals. And we used a SMART goal setting framework, which is basically setting goals that are specific, measurable, achievable, realistic, and timely. So if you leave this talk and say, I'm going to start meditating, and I'm just going to meditate for 30 minutes every day, you're probably going to fail, because that's not a goal that is realistic or achievable right now. Or if you just say, I'm going to meditate, but you don't have a plan, that's not going to work. And so maybe you are leaving this talk and say, I'm going to try to meditate for 1 minute every day, and I'm going to do it first thing in the morning, or I'm going to do it right after lunch. And I'm going to do it for 2 weeks and then see what happens, if I like it or not, if I want to change something. So changing behaviors is very, very hard for all of us, and sometimes when we change behaviors, we kind of go back and do the things the way we were used to before. And so these frameworks is really helpful because it allows you to set goals that you're more likely to achieve. So that's all I have. I think there's time for questions. Great. Thanks.
So is it working?
Yeah.
Okay. Well, so I have 2 adult children with NF. One seems like most of this would work for her, but my son, he experiences some pervasive developmental delays, and I'm wondering, like, the group video chat, is there one for adults that aren't functioning at their neurotypical age?
So that's a really good question, and you're right on. I think that probably this program wouldn't work for him. And I think I'm hoping that at some point we'll be able to develop programs that are going to be able to reach across to all patients of NF, regardless of challenges, regardless of SES or geographical distribution, but unfortunately, I think you and I can maybe talk a little bit about some resources for him. But I think for this program he wouldn't qualify, but your daughter would. So send her our way.
You addressed using maybe humor sometime with and people, and there are a lot of them who are ignorant of NF.
That's hard.
And they see you and they say, "What are those bumps all over you?" Or I've had them, and sometimes the best thing to do is if you have a little card with you, is to educate them. Say, "Here, read this card.
Yeah.
Go to ctf.org, and it'll tell you everything you need to know."
Yes.
But sometimes the temptation is there, if they're especially rude. Somebody bumps into you and goes, "Can I get those?" You go, "You'll soon find out."
Yeah. So that's great. That's great use of humor. Yes.
Yeah.
Love it. Love it. Yes. Yeah.
Using humor sometimes helps.
It's awesome. Yes. I'm going to take that and bring it to the group. It's a good skill.
Did you find, when you were looking at the depression and anxiety in people with NF, did you find a difference between the first generation, like spontaneous, and second and third generation NF patients?
That's a good question. I didn't look at that, but that should be the next study. Yes. Yeah. Yes.
Hi. I don't know. Yes. Okay, thank you. Hey, I have a quick question. I'm back here. Over here, sorry.
Okay,
I'm
the
standing.
light is, okay, sorry, yes.
So,
Thanks.
I was wondering, we talked a lot about stress, but I didn't hear so much about traumatic stress. And unfortunately, my son has encountered traumatic pieces. Do you know of any interventions or that kind of thing that is specific to trauma-informed care or trauma-responsive care?
Trauma-informed care for NF specific or
Yes.
just generally?
Yep, for NF specific.
I actually don't. I think that probably, we have a lot of trauma treatments for general population, but not NF specific. So I think probably for you, finding a psychologist who has expertise in NF and trauma may be the way to go. And I can talk to you about some resources of how to. I don't know of any of those psychologists, but I have some idea of how we can find those out. Yeah. Yep.
Is your son looking for an internship?
Oh, yes. If it has to do with computers, absolutely.
I'm just kidding. I just want to congratulate your son. I think he did an amazing job.
Oh,
putting
thank
that
you.
together.
Yes. Thanks so much. Yeah.
And getting our kids involved is, I think, a great thing.
Yes. Thank you.